Do you want to know more information about the China coronavirus outbreak? Where did it start? What are the symptoms and complications? Can the virus spread from person to person? What do we expect and what can we do about it? If so, stay tuned. Hello, I'm Dr. Derek Leao and welcome to your favorite YouTube channel. In today's video, we are going to learn about the new coronavirus. If this is your first time in this channel, we usually review different medical topics in an easy way, so don't forget to subscribe and give a like to this video. What are the coronaviruses? Coronaviruses are a large family of viruses causing illness in people and also circulate among animals like camels, cats, and bats. They are known for causing illness in humans ranging from common cold to more severe diseases like the Middle East Respiratory Syndrome or MERS and the Severe Acute Respiratory Syndrome or SARS. What is 2019 novel coronavirus? It's a new respiratory virus first identified in Wuhan, Hubei province of China. What is a novel coronavirus? It's a new coronavirus that has not been previously identified. What are the symptoms and complications that the 2019 novel coronavirus can cause? Reported illnesses have ranged from people infected with little to no symptoms to people being severely ill and dying. Symptoms can include fever, cough, shortness of breath. CDC believes at this time that the symptoms may appear as few as 2 days or as long as 14 days after exposure. Where did it start? The initial source of the 2019 novel coronavirus is still unknown, but the first cases were linked to a seafood market in Wuhan, China. The market was closed on January 1st as an effort to contain the outbreak. How many cases of the infection have been confirmed? According to the situation report of the World Health Organization of January 27, there are 2,798 confirmed cases. Of them, 2,741 are from China, with 80 deaths so far. Outside of China, there are 37 confirmed cases in 11 countries that include Japan, Republic of Korea, Vietnam, Singapore, Australia, Malaysia, Thailand, Nepal, United States of America, Canada, and France. Can the virus spread from person to person? Yes, human-to-human transmission has been confirmed. How does it compare with SARS or MERS? MERS was first identified in Saudi Arabia in 2012 with a mortality rate of 34%. SARS outbreak in 2002 had a mortality rate of 10%, and this novel coronavirus has a mortality rate around 3%. Should I be tested for 2019 novel coronavirus? If you develop fever or respiratory symptoms such as cough or shortness of breath within 14 days after traveling from Wuhan, or had close contact with somebody that had recently traveled to this area and have shown these symptoms, you should call ahead your healthcare provider and mention your recent travel history or your close contact. Your healthcare provider will work with your state's public healthcare department and will determine if you need to be tested for 2019 novel coronavirus. Is there a vaccine? Currently, there is no vaccine available to protect against the 2019 novel coronavirus. What are the treatments? There is no specific antiviral treatment for 2019 novel coronavirus infection. People infected should receive supportive care to help relieve the symptoms. For severe cases, treatment should include care to support vital organs functions. Should I be concerned about pets or other animals in the 2019 novel coronavirus? While this virus seems to have emerged from an animal source, now it is spreading from person to person. CDC recommends that people traveling to China avoid both live and dead animals. There is no reason to think that pets or animals from other countries might be a source of infection with this new coronavirus. What about animals or animal products imported from China? CDC does not have any evidence that suggests that animals or animal products imported from China pose a risk for spreading the new coronavirus. What to expect? More cases are likely to be identified in the coming days. What to do? We must get informed and share information using reliable sources like the one we have reviewed today. The Center for Disease Control and Prevention, the World Health Organization, the Journal American Medical Association, the British Medical Journal, the New England Journal of Medicine, All the links to these sources are going to be in the description below, so you can also read it. Maybe we haven't traveled to Wuhan, neither a friend of us, but maybe the friend of the friend of the friend of our friend has and doesn't know this information. Now we have the opportunity to inform him to seek a healthcare provider and decrease the probability of spreading this new coronavirus with just sharing this video. The World Health Organization standard recommendation for the general public to reduce the exposure to and the transmission of a range of illnesses, including the new coronavirus, are as follows. Wash your hands with soap and running water when hands are visibly dirty. If your hands are not visibly dirty, wash them with soap and water or use an alcohol-based hand cleanser. Wash your hands after coughing or sneezing, when caring for the sick, before, during, and after you prepare food, before eating, after toilet use, when hands are visibly dirty, after handling animals or animal waste. Cover mouth and nose with tissue, sleeve, or elbow when coughing or sneezing. Throw tissue into closed bin after use. Clean hands after coughing or sneezing and when caring for the sick. Avoid unprotected contact with sick people, including touching one's eyes, nose, or mouth, and with live farm or wild animals. Use different chopping boards and knives for raw meat and cooked foods. Wash your hands between handling raw and cooked food. Sick animals and animals that have died of diseases should not be eaten. Even in areas experiencing outbreaks, meat products can be safely consumed if these items are cooked thoroughly and properly handled during food preparation. What about shopping in a wet market? Wash hands with soap and water after touching animals and animal products. Avoid touching eyes, nose, and mouth. Avoid contact with sick animals and spoiled meat. Avoid contact with stray animals, waste, and fluids in market. And what about if you work in a wet market? Frequently wash your hands with soap and water after touching animals and animal products. Disinfect equipment and working area at least once a day. Wear protective gowns, gloves, and facial protection while handling animals and animal products. Remove protective clothing after work. Wash daily and leave at the work site. Avoid exposing family members to soiled work clothing and shoes. Thanks for your time. What do you think about a video? Do you like it? Do you want another video? Do you want to keep that statistic of the new coronavirus? If so, please help our community to grow. You can do any of the followings or all of them if you want. First, please subscribe and click the notification bell so you don't miss any new video, and also give a like to this video to show your support. Also comment what do you think about the new coronavirus, and lastly but not the least, please share this video with as much people as you can. Educating and avoiding the fake news is very important in these times. Have a good day and see you later. Bye bye.